Some new modeling data out of Ontario when it comes to the pandemic, and some optimism too when you take a closer look. Data suggests that Ontario's fourth wave has now been flattened for two primary reasons. Number one, continued public health measures like masks, and number two, high vaccination numbers. Data does show cases are increasing in some public health units. Overall, things are starting to even out. Cases are going up in children, but when it comes to hospitals and admissions and ICU capacity, things have been stable for several weeks. There's a wide range of projections, of course, here with the fall and winter upon us coming up in the next couple of months. Public health officials urging increased vaccinations as, of course, the best way to try and make sure this all contains itself. Let's bring in Dr. Kashif Pirzada, an emergency room physician. Hey, some good news, and we can certainly use that here. 14, 15 million people in Ontario waiting for this sort of stuff. When you look at the numbers each and every day, they have remained pretty flat. I mean, today it's somewhere in the 400 range. Things have been pretty steady, which is quite something when you think about all the people who live in Ontario.
No, it's quite amazing actually, and I think all Ontarians should give themselves a pat on the back for sticking to the public health guidelines, even though other places didn't. We've really accomplished something amazing together. There's a note of optimism in that report, and I think we need to carry with that because things could get worse if we're less careful. So, take a moment to celebrate, enjoy the freedoms. We've got a pretty good life now. Like stores are open, businesses are open, people are going to work, schools are open. Let's keep it that way by keeping it as safe as possible.
Ontario charting close to this sort of best case scenario that it laid out about a month ago. And I'm just curious whether you think that the data bears that out. I mean, are we going to look for, next couple of weeks and months of things staying fairly stable? Because, I look at the numbers of people who've been vaccinated, Dr. Pirzada, as you do as well. And when you're looking at the over 12 category, you've got 86% of people in Ontario, one dose, and 80% with two doses.
No, it's quite amazing, actually. We're one of the, if you take all the best provinces in Canada together, we have some of the highest rates in the world. So that's definitely making a difference. Infections are happening, outbreaks are happening, but it's running into a solid wall of vaccinated people. The problem is, and I think there was some caution in the report, is that when you get to, and you're seeing increasing rates in areas like Windsor, Ottawa, southwestern Ontario, if you get into communities that have lower vaccination rates, they're kind of like dry kindling for a fire. You throw kids in that don't have the vaccine, that could accelerate. So we have to watch out for that, and we have to minimize the risk of that as much as possible. We also don't know what colder weather will do. The cases started going up in October when things got a lot colder. So we have to keep an eye. And I think the one thing that was really interesting in the report, they mentioned how effective the vaccines were, like 7 times reduction in getting infections, like 60 times reduction in going to the ICU. So it really, vaccinations are the way out of this, and they suggest some ways to also prevent a future spike.
Tell me as well about kids, because we know there's a little bit of a surge there. Is that to be expected? How concerning is that?
We need to deal with that quickly, because if you look at numbers in Alberta and BC in kids, it's starting to accelerate in the UK as well. And, for 5 to 11s, we're literally only weeks away from getting a vaccine for them, probably by Halloween. So if we need to keep them safe as long as possible. The report also went over long-term symptoms. 10% of people post-COVID have some kind of long-term symptoms like shortness of breath or brain fog. We want as few of our people to get those symptoms as much as possible. So we have to keep a lid on infections and keep our kids safe for that extra month longer.